you can have image findings that cause you zero pain. There are people walking around in this world who are bone-on-bone knee osteoarthritis and have zero knee pain. All right, everybody, gonna keep this one nice and short for you, but something that I see over and over and over again that I think is perpetuating our kind of chronic pain epidemic that we have here in the US and Canada and other places is the notion of pain and imaging. And so generally what happens if you see a conventional based physician, whether that's your PCP or your GP, and sometimes even when you get more specialized with an ortho, is you'll tell the doctor where you're having pain. So let's say you're having shoulder pain, and he'll do a few basic tests, but then say, all right, let's get some imaging. Then you get that imaging, and that imaging comes back, and that imaging either doesn't show anything, and so the doctor says, okay, well, let's just put you on some ibuprofen or an opiate or something like that, or refer to a specialist if you're at kind of the base floor of your PCP or something like that. Or something will come back such as a supraspinatus tear, and then they'll say, okay, this is causing your pain, and so therefore here are your options. You could do a steroid injection, you can do physical therapy, and with the insurance model, generally you have to do physical therapy before getting the steroid injection, and then I'll refer you to surgery. Or if you're with the surgeon will say, okay, I can go in and I can repair that. However, it is possible that that pain actually was due to the supraspinatus tendon. A patient had anterior shoulder pain, it was worse kind of going overhead out to the side. And then if someone were to do more in-depth testing, it would show that, yes, it actually was supraspinatus. And so that happens, right? They're correct on that because sometimes the imaging matches up. However, a large amount of time, the imaging doesn't always match up. And so, for example, if this patient had posterior shoulder pain, posterior shoulder pain is generally not supraspinatus. It's actually coming from the neck or axillary nerve entrapment in the posterior aspect. But if their pain was posterior, but they still had a supraspinatus tear, which wasn't actually causing them pain, because you can, and I'll repeat this, you can have image findings that cause you zero pain. There are people walking around in this world who are bone-on-bone knee osteoarthritis and have zero knee pain, okay? So it's possible. So if the pain is not coming from supraspinatus and they take an image and it shows a supraspinatus tear, can you see how if they go and they do steroid injections or surgery for the supraspinatus tendon, that this patient is still likely going to be in pain? And these are just all these unnecessary interventions and injections that are not actually contributing to resolution of the pain. And now, this can also happen in the regenerative injection world. So if you're working with a physician who still takes that approach, but they just inject PRP instead of steroids, then you can still end up in that exact same situation where they treat with PRP your shoulder, and then you go, it doesn't work, and then you go, PRP doesn't work. Just like other people told me, PRP doesn't work. When in reality, it's actually just that the correct structure wasn't treated because the proper diagnosis was not achieved, okay? And so today I'm really, really stressing to you that if you've had interventions for something specific and you feel like a lot of those interventions were solely based off of your imaging studies and you are not seeing results, I really strongly encourage you to go find a physician, do the research if you have to find a physician who is going to do an in-depth physical exam to help identify what structures are causing you pain, so that way you can have more effective treatment options presented to you. All right, see you later.